Word of Hong Kong's first death from the coronavirus seemed to add a sense of urgency today at this pharmacy selling protective face masks. We're very worried, said this woman. The government can't control this virus. That's why we feel helpless, why we're looking for masks everywhere. With that worry also comes price gouging. A pack of 50 masks that would normally have cost $8 Canadian sells here for $60. This man told us the anxiety is making people overpay.
I think that's the sentiment in Hong Kong right now. It is festering over the past couple of days.
The man who died in hospital Monday morning had visited Wuhan in China and was just 39 years old, but he had diabetes, which made him higher risk. It's the other new cases of infection that authorities are having a harder time explaining. Most of the people here who become sick have had a direct connection to China's Wuhan area, either by visiting themselves or having a relative who did. But doctors say in 2 new cases and 2 older ones, it's not clear how the patients got sick, calling it an invisible chain of infection.
There's a significant risk of community transmission in Hong Kong.
In one instance, a Hong Kong clothing store owner got sick, perhaps catching the virus from a customer. Schools and universities have been closed and students urged to stay home and avoid big groups. But clearly, some people are already getting stir-crazy with the restrictions.
We need to go out to have the fresh breath, fresh air.
Up at the landmark Peak Viewpoint, we met teacher Eva Young and a bunch of her teenage students, all of whom said they just had to take a break from their self-imposed quarantine.
Wow, and so Chris, can you give us more of a sense of just what it's like in Hong Kong right now?
Well, we were talking just there about masks, Andrew. It's now Wednesday morning here, and we got these pictures sent to us overnight from a big lineup across the harbor in Kowloon where people, hundreds of people, literally camped out overnight to try to get these face masks when they heard that a supplier was releasing 500,000 of them in a couple of hours from now. So that speaks to the urgency of the demand here. Andrew.
Wow, and what about the walkout by healthcare workers?
Well, it's day 3 now of this walkout. Several thousand healthcare workers are trying to pressure Carrie Lam's government to close the last remaining land crossings with mainland China to try to prevent people from bringing in, potentially, the coronavirus. So far, Carrie Lam has said no, they're not going to do that, but today is the deadline that the healthcare workers have set. If that doesn't happen, there could be more escalation. Andrew.
All right, Chris Brown in Hong Kong. Thanks very much.